weight loss drug war in India is set to intensify. The demand for Mounjaro and Wegovy has been increasing steadily. And now these medicines are India's top selling drugs. With Ozempic entering into the competition, the battle for medical weight loss is only set to grow. Everyone is very interested to know two questions. One is by when Ozempic will be available on chemist shops. Second, at what price points?
Yeah, and that is something which is very, I know that everybody wants to know, and I should tell you that while I'm talking to you, the trucks are there on the road, and then it is getting in the distribution chain across India. So by the time actually we finish, it should be there in the C&FAs in all the states, and then soon in the pharmacy. We are very sensitive about India, and we have taken an approach of India tiered pricing. We did that also with the semaglutide in obesity by reducing the price by 37%. And for this anti-diabetes, Ozempic, we have actually brought in at a price which is very nominal, 2,200 rupees per week price.
It's 2,200 per week?
Per week is the price going to be there for Ozempic, and that means a single pen will have 4 doses, and it will only cost 8,800 rupees inclusive of taxes. So that's what the price which is actually there when the diabetes control is required, and along with that, not only diabetes control but also weight loss, CVD benefits which are also quite listed, and as well as the CKD benefits which comes along with the drug.
Are we going to see the product coming in various strengths and forms?
This is going to be available in 3 strengths, of course. To start with, it is going to be 0.25, which is 2,200, but then we have got 0.5, and then we have got 1 milligram, and the highest of the dose is only 11,175. So the gradation is not going as per the strength. It's not a linear curve. It is just a very marginal kind of an increase over the strength. But by and large, it is quite within the reach for affordability for quite a lot of patients in India.
Right. Vikrant, in the last few years, we have seen massive buzz around Ozempic involving lot of celebrity use, and the drug has been able to generate a lot of debate and global headlines. So how Novo Nordisk plans to position this drug and cut through the hype so that the drug is used responsibly, not just for the cosmetic purposes, but also under the medical supervision?
And that is one of the reasons actually I come forward and also appeal to the people that do not self-medicate. There are so many able doctors in India, and they are within the arm's length reach. People should go to their doctor before going to the pharmacy to access the medication, not only for semaglutide, but for any medication, specifically for semaglutide when they are treating their metabolic disorder. I think it is pertinent that they go to the right doctor, take the right prescription, and get it dispensed rightly. But on the other side, it's also one of our duty and responsibility just to create the awareness about diabetes, better control, better treatment, and better outcome. You'll be surprised that we have got 100 million people who are diabetic, and only half of them know about their state as diabetes. By the time person comes to know that they are having diabetes, actually half the beta cells have already died.
Right.
So at the end, out of 100 patients, only 6% of the people have got the optimum outcome in terms of the glycemic control and kind of weight they should have.
But what is the medical opinion? Are these drugs safe to take, or there are some precautions that people might need to take? We decided to speak on to some leading doctors. Dr. Mittal, we want to understand that what has been your clinical experience. Do you see people coming to you and asking for the prescription of weight loss drugs?
Yeah, I think, Himani, the issue is exactly what you said, weight loss drugs. People who are looking for weight loss, there are lots of them coming and asking for the drugs. You know, they want to lose weight, they are frustrated, they They've tried everything and then they want to use these new, what they consider magic drugs. On the other hand, for us, these drugs are not just weight loss drugs. They are good anti-diabetic drugs, which also protect the heart and the kidney, the liver, so many other actions. For those group of patients, we are the ones who are sort of convincing or pushing the patient to use the drug. For the pure cosmetic weight loss, it's mostly the patients who are coming to us and asking for it.
Doctor, I think the most important question is, what is the eligibility criteria? What do you consider before prescribing these drugs?
So I think it depends on the overall health of the person. So if you're at a BMI which is not very high, maybe above 27, definitely if above 30, and you have coexistent conditions like diabetes, like fatty liver, like hypertension, heart disease, even early kidney disease, you are clearly a candidate for these drugs. So here, as I said, the health issue, the coexisting health conditions determine that. Then there are those who are just obese and don't really have too many other things. There, of course, we prefer to give it to those over 35, but eligibility the BMI, eligibility is any BMI over 30, even without any other coexisting conditions, that person can also be a candidate.
Doctor, as you rightly said, magic pill. Do you think this drug is a magic pill, or we need to do something more while taking this drug?
Well, these drugs are a huge discovery, but they are certainly not a cure, nor can they get rid of India's obesity problem. So even to get best effect from the drugs, and to save your health, save your muscles, really get maximum benefit, you need to ensure that you're taking adequate protein, adequate fiber in your diet, and very importantly, exercise should include strength training. Often Indians, all of us think going for a walk or yoga and all is very good exercise, but strength training is not emphasized, especially in the elderly. So I think that focus has to be there. Whenever you lose weight fast through any mechanism, you will also lose some muscle. So to save your muscles, strength training, good protein intake, and you're ready to go.
India has been seeing a massive demand of the weight loss drugs like Wegovy, Ozempic and Mounjaro. Now there is also a concern of misuse of these drugs for cosmetic purposes, as we have seen in the Western countries already. What do you think what are the preventive steps that India should start taking already?
So thank you for asking this really big, serious and important question. So number one, obesity is being declared like a disease. That is one aspect. And it is also estimated that about 40% of the adult population in urban areas are either, morbidly obese or just overweight. And everybody is moving into this as a quick fix solution. I think that it's important for us to say that, hitherto people looked at bariatric surgery, which then a doctor supervised, and only to people who had a significantly, high BMI, who needed it for medical purposes, whether it's diabetes or various other things. Now this is, an injection that anybody can buy. So in a way, it is a significant answer. But the single message I want to give is that it needs medical supervision for dosage, to control complications, and to ensure that while you're losing weight, you're not losing muscle. This will then have other implications on the joints, on the overall musculoskeletal system. So therefore, using it judiciously, appropriately, under medical supervision, whether it's Mounjaro or Ozempic or any of Wegovy, all of these are very powerful. They can be very helpful to the right person, but should be done with medical supervision.
They were launched with a particular reason, that they were basically targeted at a certain select group of patients who had either type 2 diabetes, or those who were not diabetic but they had obesity, and they were either moderate to severely obese, and they had multiple comorbid factors, like they had a poor cardiovascular outcome, they had fatty liver, they had PCODs, or they had metabolic liver disease. So to neutralize these risk factors and basically to have a better cardiovascular outcomes, to reduce their cardiovascular risk, these anti-obesity drugs were used basically to have a significant reduction in their weight, and to also achieve at the same time a adequate control of their diabetes, so that we can achieve a adequate control and on their metabolic parameters and achieve a good clinical efficacy. Now what has happened is that over a period of time, because of the large scale publicity around these drugs, and as you rightly said about the hype of these drugs, a lot of people who did not fit into the criteria, as I said, the criteria of moderate to severe obesity with diabetes or without diabetes, and having multiple cardiovascular and other metabolic derangements, they also, but normal people with a little bit of weight gain, they also started using these drugs without trying their traditional methods, like without making adequate lifestyle modifications, without making any change in their dietary and exercise or any other lifestyle changes. They started using these drugs for a long period of time. As a result, there was a lot of large scale changes in their body structure, in their body parameters, which led to a very lean and thin structure, which was completely inappropriate.
This was when they started taking drug without the medical
Without the medical supervision and without fitting into the criteria of starting the drug. As a result, the lean and thin, because some of the celebrities were using it, especially the Bollywood celebrities, some of them were using it, and so to copy them, many of the, especially the women, started using it, and to get into shape and lose a little bit of weight. So the inappropriate usage of these drugs can create a lot of havoc. They can play with your cardiometabolic parameters. They can cause severe loss of protein. They can cause severe loss of fat in the body, and they can cause they can leave you with a loss of severe loss of nutrition in the body, and they can cause remarkable changes in your body which might affect you adversely. Most of the trials that have been done on these drugs, whether we talk about tirzepatide or we talk about semaglutide, most of these trials have shown us over a period of time that 15 to 16% of reduction of the body weight has been achieved over a considerable period of time if they have been used over a period of time in appropriate dosages. And also along with that, there have been adequate control of diabetes in patients who are diabetic, and also there have been along with that reduction in their fatty liver and reduction in people with PCODs and reduction in all their other comorbidities.
And in your clinical practice, have you seen that people are able to achieve that sort of weight loss when these drugs are prescribed to them?
Now see, some of the people have achieved weight loss. Some of the people have not had weight loss to the amount that we have seen or expected to happen. But weight loss definitely happens, but a lot of the weight loss needs to be seen in a individual basis. It needs to be also seen as to how much of lifestyle changes they are doing. It depends on their dietary habits. It also depends on the pattern of of the lifestyle changes that they have made in their life.
So that's a medical view. The doctors point towards the benefits of using weight loss drugs while also underlining the need for caution and side effects. And what about the patients who are already using these drugs? For some, it's a life-changing experience, while others are still trying to adjust to these drugs and hoping to see some benefits. What has been your journey on this weight loss drug and what has been your observations?
Well, I've had 7 doses of this medication, this injection, and it's been like over 7 C's of healthcare. I've had knee replacement, I had severe psoriasis on my foot, and I came to this solution as the last resort. And it's been a wonderful journey. I feel comfortable, I'm able to walk. In these 7 weeks, I've lost more than 7 kilos. Of course, I have observed the strict regimen of exercises and my food habits. I don't go hungry. I don't overeat. I don't have any side effects except maybe manageable constipation, which was even earlier there, but it's manageable. I don't feel sick. I have no side effects. And I'm happy I'm on this journey, and I need to continue until I reach my ideal weight where I'm comfortable breathing. It's led to not only loss of weight, it has increased my capacity of lungs. I was happy to note that today my oxygen level is 99, which normally it used to be 94, 95. And I'm able to walk because dynamic weight on the knees is 4, 5 times, 6 times more. So having lost 7 kilos, my knees feel comfortable by about 30 kilos on each step. I'm very happy with it. It's medically a revolution which is going to change lives.
We are with Anishka today, who was put on Mounjaro 9 months ago. She has by now lost almost 20 kgs. She was put on Mounjaro because her HbA1c levels were around 14 and her weight was more than 100 kilograms. Let's understand her story. Thank you, Anishka, for agreeing to talk to us.
Yeah.
Anishka, what has been your journey? Did you face any side effects as well, or do you think that this has been a life-changing drug for you?
So I didn't have a lot of side effects for 1 or 2 months. I had a little bit of discomfort in my stomach, but after that my body has adjusted to it and I'm very happy with the drug. It's not a drug that you can say is a magical drug. It's only for diabetes.
Right. So, were you obese from the childhood, or there were certain circumstances because of which you gained weight and your HbA1c levels crossed 14?
So I was obese. I was very fat when I had PCOD issues. Because of that, my metabolism was very down. And I was more than 100 kgs because of my cycle was not correct because of PCOD. So I got diabetic.
So, did you face some sort of discomforts while you started the Mounjaro injections, or was your journey very smooth on the drug?
So I had little discomfort in the beginning. You can say around 1 month or something because of adjustments in my body. But after that, I didn't have any side effect. I was good.
Are you following any other routine as well apart from just taking the injection?
So I am under a very good team where I am being monitored day by day what I'm eating. I'm on diets. I am on exercise. Initially, I started with cardio because I was really obese. And then I started with muscle and weight gain, weight training under a trainer. Now I'm good enough. I've lost good amount.
Will you be able to tell our viewers on what weight you started taking the drug and where are you now? How the journey has been? Have you been cutting on your cravings as well, or while having the drug you don't develop cravings as such which you used to have earlier?
Yeah, so I was more than 100 kgs. Now I'm around 79.5. So I've lost good amount of weight. So I don't get any cravings now. So my appetite has come down. I feel like eating little bit, but I eat everything, but in small amounts. so that I don't kill my cravings. But I don't have cravings because of the drug. It's really helping me, and I'm on a high protein diet. So I am very much monitored, taking, flax seeds to dry fruits to milk to non-veg. I'm a non-veg eater. So I'm good with it. I don't feel lethargic. I feel more energetic and lighter comparatively.
As we heard, Anshika, this is not only about the drug. While you are taking the anti-obesity injections, you also have to follow a certain set of guidelines, like taking the appropriate diet along with exercise and be under the medical supervision always. Eli Lilly's weight loss drug Mounjaro has become India's top-selling drug by value. Now, with the entry of Novo Nordisk's blockbuster drug Ozempic, Eli Lilly is also gearing up for competition.
The growing demand for weight loss medicines in India can be seen as an overall positive for public health in India, where 6.5% of the adult population is living with obesity and now represents nearly 100 million people. Now, we know the causes for this increase in obesity is multifactorial, including increased urbanization, more sedentary lifestyles, as well as diet changes, all which are making weight management a more pressing concern. There's also increased awareness of obesity as a chronic medical condition and not just down to individual willpower. And while weight loss medicines can play an important role, we know that a sustained weight management program should also include lifestyle changes, healthy eating, and where appropriate, medical intervention. GLP-1 medicines are medically approved, prescription-only medicines that represent a scientific advance but should not be considered as magic therapies. We know that obesity and type 2 diabetes are chronic long-term conditions which require comprehensive care, and these therapies are best used under supervision of healthcare professionals when paired with lifestyle changes such as diet and exercise. At Lilly, safety is our highest priority. We do not promote, nor do we endorse any off-label use of tirzepatide or its use for cosmetic weight loss.
As demand for these drugs keep rising and more companies and brands keep entering the market, India is set to see the biggest shift in its market for medicines. The only challenge is to make people aware of the benefits and side effects and ensure the safe usage of these drugs.